Welcome to episode number 5 of The Doctor's Dilemma, Overcoming Burnout. I'm really excited to welcome Dr. Treziak and Dr. Mazzarelli here from Cooper University Healthcare, and they are the authors of Compassionomics, which is a book about how compassion actually makes a difference for patients. Thank you so much for being here.
Thank you, Hansa.
Thank you.
So tell me how you got to this book and what you found that was so compelling.
So in this book, what we did is we curated all the scientific evidence to answer one question. Does compassion really matter? Now, you may say, of course, compassion matters. It's part of the art of medicine. We ought to treat all people with compassion. We have a moral and ethical obligation. And of course, that's true. But is compassion just part of the art of medicine, or are there also evidence-based effects belonging in the science of medicine? And what is the evidence? So we went on a 2-year journey through all the medical literature. And what we did is we tested a hypothesis. The hypothesis that compassion matters for patients, for patient care, and for those who care for patients. So we were testing that compassion doesn't just matter in meaningful ways, but also in measurable ways.
Anthony, what did you find in terms of how it makes a difference in patient health?
So for patients, it changes their outcomes. So if there's a better connection between those who provide care and those that receive it, it actually can change their outcomes. We actually found 22 different mechanisms in which compassion can actually help change the actual outcomes of patients. It can actually lower the overall costs of healthcare. And then for those that provide care, it actually has benefits for those that provide care as well. So in several different studies, it actually can, those that get care, those that receive care for patients, they actually have better outcomes, whether it's with their primary care doctor. They'll have those who are diabetics had better blood sugar control, those who had better blood cholesterol levels, basically almost any metric that they looked at. When you had a doctor who had higher levels of compassion on scientific scales that looked at this objectively, you had patients that had better outcomes.
So our frontline workers are really suffering right now. They were already stressed out and burned out before COVID hit. And now with COVID, it seems like it's an endless journey with more stress and more injury. How do you both feel that compassion could actually help them with their burnout?
What we found in Compassionomics is there's abundant evidence that compassion can be a powerful therapy for the giver too, specifically in reducing burnout among healthcare workers. But I want to be clear, you don't have to be a healthcare worker to feel burned out, especially in 2020. So our message for you is that there is abundant scientific evidence that our relationships are the key to resilience and resistance to feeling burned out, and specifically treating other people with compassion. There's evidence that compassion for others can help you forget your own worries, at least temporarily. It can reduce symptoms of depression and reduce symptoms of anxiety and reduce psychological distress over whatever it is that you're going through at the present time. And so compassion is a powerful therapy, not only for healthcare workers, but for all of us. And right now, I think what we need more than anything else is compassion for others.
So with mental health issues on the rise, compassion seems to be a potential possibility for prevention and even treatment. Let me ask you this. What do you think people should do in order to incorporate compassion into their lives? And you mentioned that college students and middle school students are also not understanding that compassion is really important. What would be your message to those folks as well?
Well, Hansa, the answer would be to look to be other focused. That's the idea. I mean, compassion is the idea of having empathy, which is understanding others' emotions with a sincere desire to help and to actually act on it. So if you can start to be other focused, to focus on others, that would be the message that we would bring and say that you should focus on. So most of the time, the advice people give is that you should look to yourself and look to your passions and what do you want to do. But we think that's really where that advice isn't as good, and that there's a lot of evidence in the scientific literature that if you can start to focus on others, that's when you can connect and have the benefit to yourself. that you not only will the other people benefit from the things that you're doing to help others, but you actually have that benefit to yourself.
So it's not about the I, it's about the we, it sounds like. The message of 2020.
So an important first step in any scientific pursuit, including curating all the scientific evidence around Compassionomics, is getting our nomenclature right. So defining what is compassion. So most scientists define compassion as an emotional response to another's pain or suffering involving an authentic desire to help. So it's different from a closely related term, empathy, which is the sensing, detecting, feeling, and understanding component, and that compassion also involves taking action. And there are neuroscience underpinnings behind the distinction in terms. So using a brain imaging test called functional MRI, neuroscientists have found that when you have empathy for someone, you bear witness to pain or suffering, it actually activates the area of your brain that is the pain center of your brain. So I feel your pain, that actually has neuroscience behind it. But when you take action to alleviate someone's pain or suffering with compassion, it actually activates a different neural structure. A different area of the brain is activated at that time. It is an area of the brain that's considered a reward center of positive emotion and affiliation. And so that's why we often say, and the science supports, empathy hurts, but compassion heals.
In this day and age where we're dealing with the pandemic and we're dealing with suffering and with economic collapse, to witness all of that will light up those parts of your brain with empathy, the part that hurts. But it's to take action, it's to provide compassion where you will get the benefits yourself. Not only will the people that you help get the benefit, but that's where you can actually light up those reward parts of the brain and actually provide compassion and help yourself as well.
So basically what we want to take home as the audience from your message is that compassion helps others, but it really, really helps us as individuals too. And, it also helps towards mental health as well as the symptoms of burnout, both for healthcare workers and for the audience. Thank you so much for being here, and we really appreciate the time that you've taken, and looking really, really forward to having more people read your book, Compassionomics. Thank you, doctors.
Thank you, Hansa.
Thanks.